Good morning, madam. My name is Subhatrika Manjari Veersingh. I am nursing officer in Ward 29 National Hospital, Sri Lanka. Now I am going to do very important procedure all world population. It is hand washing and hand hygiene procedure. In the world these days, most common disease is COVID-19 infection. We can 90% prevent the COVID-19 infection by proper hand washing procedure. After this slide presentation, I will show you how to do hand washing procedure. Madam, I show you my procedure, my theory. Hand hygiene and hand washing procedure. Why infection control important? Both patient and healthcare personnel can be exposed to pathogens. Contact with blood, oral and respiratory secretions and contaminated equipment occurs. Proper procedures can prevent transmission of infections among patients and healthcare patients. Why reduce infection? To reduce mobility and mortality, to reduce healthcare cost, to reduce after effect to family and community, to reduce respiratory tract infection, urine tract infection, surgical site infection and wound infection and extra. HAI means healthcare associated infection. HAI, an infection acquired by patients 48 hours after admission. HAI, acquired by patients during their hospital stay. Also, healthcare worker can acquire while working in hospital. May appear even after discharge. Patient with HAI have to stay longer. Treated with expensive antibiotics. Have a high mortality. How to prevent HAI? Standard precautions: cleaning, disinfection and sterilization, clinical guidelines, waste management, infection control in special units, infection control in healthcare workers, infection control policies, hand hygiene and hand washing, use of gloves, use of masks, disposal of sharps, setting up and administration of intravenous fluids, wound care, care of drains, urinary catheterization and catheter care, waste disposal, hospital linen, hospital cleaning, sterilization and disinfection. Ward policy for nursing patients with blood-borne disease. Standard precautions: hand washing, gloves, PPE, patient care equipment, cleaning of instruments, environmental control, management of spills, linen, occupational health, patient isolation. Why hand washing is important among healthcare workers? Hand hygiene is one of most important ways to prevent the spread of infection. Hand hygiene reduces the incidence of healthcare associated infections. Important aspects of hand hygiene. Techniques. 5 moments of hand hygiene. Factors for poor adherence with hand hygiene. Hand washing agents cause irritation and dryness. Lack of sinks. Lack of soap and paper towel. Not enough time. Taking priority of patient's needs. Lack of knowledge of guidelines. Forgetfulness. Disagreement with the recommendations. Hand washing steps. Nails must be clean and short. Remove all jewelry. Wet hands under running water. Apply soap. Rub palm to palm with fingers interlaced. Rub the back of the both palms. Rub back of the interlaced fingers. Remember to wash back thumbs. Rub both palms with finger. Wash hands under running water. Hand washing agent. running water, soap, 4% chlorhexidine, 7.5 propanediene, 70% alcohol, based hand rub. This is the father of the hand washing. Ignore Phillips Semmelweis. From 1847, after a long journey, so many things happened. Today we adhere hand washing techniques policy. Hand washing steps, 5 moments of hand washing using hand rub, global hand washing day. This is the how to hand rub use and how to hand wash. 5 moments for hand hygiene. Now I show. Moment 1. Before touching a patient. Moment 2. Before a procedure. Moment 3. After a procedure or body fluid exposure risk. Moment 4. After touching a patient. Moment 5. After touching a patient's immediate surroundings when the patient has not been touched. Clean hands save lives. This is some pictures. This is the hand rub bottle. Hand washing sink. Drying your hands. It is important to dry your hands thoroughly after washing them. Damp hands collected microorganisms. Damp hands spread potentially infectious microorganisms. Damp hand might become colonized with potentially infectious microorganisms. Alcohol hand rub. Use as an alternative to hand washing. Do not use visibly soiled hand. Have a good immediate activity. Does not require drying with towel. Less time consuming. Does not cause drying of skin. Can prepare in 97 ml of 70% alcohol plus 3 ml glycerol. Hand washing menu. Before doing an invasive procedure. Before handling invasive devices, catheters, drains and nebulizers. Before and after contact with the patient. Before wearing and after removing gloves. After contact with blood or body fluids. Contact with wounds. Moving from a contaminated body site to a clean body site. Meal break. After blowing or wiping nose. After using the toilet. This is mist spots. Gloves are not substitutes for hand washing. Roll-in gloves. This is the removing gloves. Thank you very much, madam. Thank you very much, madam. Then now I show you my hand washing procedure. Madam, this is my hand washing area. Now I am use running water and soap for hand washing. If you don't have available running water, you can use hand rub. But before any surgical procedure, you should use running water. Don't use hand rub. This is my hand washing procedure. First, rub palm to palm with fingers interlaced. Second, rub the back of the both palms. Third, rub back of the interlaced fingers. Wash back thumbs. Fifth one, have both palms with fingers. Wash hands under running water. Now I am dry my hand with hand towel. Thank you very much, family.